Welcome to the Luke Coutinho Show, where we can learn to reimagine our lifestyle.
Dr. Vikas Agarwal, good evening. And thank you
Hi,
so much
Luke.
for being on our show, Reimagine Your Lifestyle. You know, when I got to know about you, I mean, I know your work, I've read about what you've been doing, and sleep is very close to my heart. You know, even though I practice in the field of integrative and lifestyle medicine, cancer being my specialty, I think 13 years ago and now, today, we put sleep at the top of our health paradigm. You know, nutrition is important, exercise is important, medicine is important, but we've seen over the years a distinct, difference in the data of patients who are sleep deprived and patients who sleep well and the impact on every single condition that they have. And you are known as the father of sleep surgery in our country. So I'm really excited to have you today and, dive into the subject of sleep and pick your brains for all the knowledge that can help India to sleep deeper. That's what we're trying to do right now. You know, we're trying to lead from the front that India needs to sleep deeper because of all the metabolic syndromes, the disease, and everything that's happening. So thank you so much. I know you've had a long day with patients and you have patients even after this. So we appreciate your time. Thank you, Dr. Vikas.
Thank you, Luke. Thank you for having me here. And sleep is a subject which is, again, very, very close to my heart. So I'm an ENT surgeon. I do everything in ENT. But sleep surgery is what is very close to my heart because I believe a proper sleep is required to stay healthy. And sleep disorders are the mother of all diseases. You also know that a person who's having sleep apnea or even insomnia and other kind of sleep issues, he gets affected by diabetes and even cancers and heart attacks and everything, strokes and whatnot. It's all proven now. Sleep apnea is actually a leading cause of all these problems. And not only that, a person who has not slept nicely, a patient of sleep apnea, would actually be sleepy and can cause accident while driving. He's sleepy in the day. So not only his own life, he's dangerous to others' lives as well. And in the developed countries, you cannot get a license issued or renewed unless you get your sleep study cleared. In our country, there's no such law as yet, but we are trying that such law is made and such law is effective. So I'm pretty excited to discuss this sleep subject with you.
Right. Yeah. Yeah. No, a few years ago, I don't even know currently now, the leading cause of death in the US was actually road accidents.
Yeah, absolutely.
Yeah. And most of it was the driver falling asleep at the wheel.
Right.
So no, it's apt what you say, doctor. We know that India is a sleep deprived country, and there are many reasons. That technology, OTT platforms, and just lifestyle in general has changed. What have you been seeing amongst the patients who come to you as the main causes of the main changes in their lifestyle that is bringing on this sleep apnea? What have your observations been over the last couple of months and years?
So most of the people now actually, as you rightly said, are addicted to OTT platforms. They come from work late, then they have a binge of eating because they have been hungry in the day, which is again not good because in the night you should have less food. They eat more food and then they switch on their Netflix and Amazon Prime and they glue to it. They will wake up till 1 or 2 in the night and then they would try to get up late in the morning, but obviously they have to go to work. So the sleep is insufficient anyways. And with all that they see just before going to sleep, all the violence and all those actions, they do not have a natural sleep anyways. On top of that, during the binge of watching, they also keep on eating the unnecessary calories, which again helps them to put weight, which further actually accentuates or aggravates this sleep apnea issue. So we need to learn the habit of going to bed early and getting up early, not having a sleep hygiene. So I mean, you should not be watching movies and action and violence before going off to sleep. If at all you have to watch something which is very calm and soothing for some time, and then go to sleep in time. Switch off your phones because most of the people cannot switch their phones off, and it keeps on buzzing throughout the night, which keeps on disturbing. So sleep hygiene is something that we, as a nation, should be talking of and we should be, practicing. Very, very important. 6 to 7 hours of quality sleep is required for every human being, at least.
And everyone is different. So would you say in your experience, it's quality over quantity? That if we go through all our REM and non-REM cycles, the quality is met? Because some people wake up in 6 hours fully ready for the day, no caffeine, they've slept very deeply. And some people sleep 9 hours, but they're still tired because they keep waking up, light sleep, broken cycles.
So regarding the second type that you talk, that is the most important thing. Why do people, even after sleeping for 9 hours, are still not fresh? And the majority of the people have some kind of a block in their airway. Either it is the deviated septum, some allergy, some tonsil enlargement, or other kind of a issue, because half of the population has got a deviated septum. As a ENT, I deal with this subject on a daily basis. And as I said, half of the population having deviated septum and 25% of the population is having allergy. So almost 2/3 of the population is suffering from some kind of disturbance in the breathing. And we call it upper airway resistance syndrome. Upper airway resistance. So this is a stage before sleep apnea, right? So you develop sleep apnea gradually. You start with simple snoring, and then you go to upper airway resistance, and then you develop frank sleep apnea. So people who cannot get fresh even after 8 to 9 hours of sleep, and apparently that they have no stress on their mind and still they are getting up not fresh, they should be medically examined to look at the upper airway resistance. That's a very, very important thing.
And doctor, so, we have a lot of people out there, and, in India, many, many conditions go undiagnosed for a long time because people choose to live with it. And they're just like, okay, this is how it is, whether it's pre-diabetes, whether it's sleep apnea. So what are some of the symptoms that people can look for to think that, okay, you gave us one powerful one. I'm sleeping so many hours, but I'm waking up and I'm still not fresh. How, what else can I look at as a symptom to decide that now I need to go and see Dr. Vikas?
Luck, not me. You can see
anyone, yeah, but right now you're there in front of me. So yes.
Most important thing is the noise. If somebody is snoring and not getting up fresh, is a sure shot case of either upper airway resistance or frank sleep apnea, obstructive sleep apnea. So luckily, snoring is as a symptom is the most important thing that one should be looking at. You will be able to, look at more than 70-80% of these patients only by, the bed partner looking at the snoring. And sometimes they can look at witnessed apnea, that the person is actually choking in the breath in his sleep. So if something like that is seen, that's called witnessed apnea. Apnea means stoppage of breathing. So if somebody is stopping to breathe, it's a diagnostic thing. Even without a sleep study, it can be diagnosed that the person is having sleep apnea. But if somebody is only snoring and not getting up fresh, for sure, he is an early stage of sleep apnea or upper airway resistance.
And what are the tests that a patient should ask for when they go to a doctor? What are the tests? So like, let's say, for example, let me put myself as a hypothetical case study. Okay, I snore and I don't wake up fresh. Thank God I do, but I'm coming right now. What test would I go through? Or, I would just love to know how that works, basically. Yeah.
Right. So unfortunately, when patients go to their family physicians, the awareness in the family physicians is still not at that level. So many times they look for diabetes, blood pressure, and thyroid at the most. And if all this is normal, they are said that, okay, you're fine, there's no problem with you. But what is required is to perform a sleep study.
Right. Okay.
So sleep study will tell whether you have sleep apnea or not.
Okay.
So sleep study is not a very complicated stuff, as is the common understanding. So there are various levels of sleep study. Level 1 is a pretty complicated one with a lot of wires in the sleep lab. You need not go through that. There's a very simple one. There's a cannula here, there's a wire here, and there's a chest belt here. Only 3 of them. That's called level 3 sleep study, which can be done at home.
Oh, okay.
There's a study which can be only by putting a small tape and a small tablet here. It's from ResMed. It's available on Amazon. Cost only 2,000 or 3,000 rupees. So these studies are good studies to screen for sleep apnea. These are good screening study. So anybody can do it at home. There are a lot of companies now doing these sleep studies at home at a very affordable price. So if there is a suspicion for sleep apnea, a screening sleep study should be done even at the patient's home, which can be ordered online. Now various agencies are doing that. Now, if there is sleep apnea or there's perceived blockage of the nose or some sinus issue, then any ENT surgeon can do a CT scan of the nose, examination of the throat for the enlarged tonsils. A basic ENT examination can tell whether there's a blockage or not, which is obvious. Suppose if the blockage is not seen and the sleep study is positive, then we perform something called sleep endoscopy. So this is a specialized test which is not done by every doctor or ENT surgeon, in which we put the patient onto sleep by giving medicines and then put a scope in the nose, go into the throat and see which part of the anatomy is collapsing, what is causing sleep apnea or what is causing snoring. So these are the tests from basic to specialized that we perform to diagnose sleep apnea and its cause. If the cause is known in a young patient, then we can remove that cause. If somebody's tonsils are large, we remove the tonsil with plasma, so no bleeding, no pain. In the kids, adenoid enlargement, we remove the adenoids with plasma. Septoplasty, soft palate length is reduced. Palatoplasty, a lot of surgeries are there to cure a young patient. And if the patient is old, then possibly a CPAP therapy. When we put in a mask and the patient breathes through that mask through the night so that it keeps the airway open. So doctor, this is in short.
Sorry, So coming back to kids, adenoids is a big problem, and you have two sets of thinking in a parent. We don't want to touch the adenoids, and some parents are, let's get it removed because obviously the child is going to get better. Have you correlated mouth breathing of a child with the, progression of adenoids and problems as such?
So tonsils are pretty known to almost everybody, but adenoid is a new word for most of the parents. So when the child is presenting with mouth breathing, disturbed sleep, getting up, irritable in the night and getting up irritable in the school, many times they do not understand what is the matter. And when we say that, okay, your child has got almost a grade 4, a full blocked adenoid, and it needs to be removed, there's a concern, no surgery. So it is considered that the tonsil adenoids are guards. They are obviously guards for infection to go inside, and they respond to the infection or inflammation. But suppose if the guard is, your building guard is that fat and your door is blocked by the guard itself, what do you have to do? You have to cut the guard to size so that you can enter, right? Similarly, if there's no air passage, if the nose is blocked because of the adenoids, you can't wait for 10, 15 years of age for the adenoids to possibly regress, which they may not. So in that case, removal of the adenoids by plasma is a bloodless and painless procedure, which solves the problem on the same day, instantly. And there's no side effect of the problem of this procedure if done properly, in proper hands. So tonsils can be trimmed to size, adenoids can be, reduced by plasma, and there's absolutely no side effect. There's no long-term effect. I have been doing this surgery for the last 24 years now, and with the plasma for the last 16, 17 years. There's absolutely no side effect, and it doesn't regrow. So there's no problem in getting the adenoids removed. This is a message for the parents whose kids are suffering from mouth breathing because of the adenoids, because whatever you do, if the child is mouth breathing in the whole, say, 10, 15, 20 years of childhood, he will remain a mouth breather even if the adenoids regress. And he will short be a patient of adult sleep apnea, almost always.
Right.
So
no, I completely agree with you, because there are all these arguments. Adenoids is, of course, like you rightly said, it's part of our immune system. It has its role. But at the same time, sometimes our immune systems can cause problems for us, like an autoimmune. It can work two ways. So sometimes I think the compromise for the larger good, which is better sleep over, just that small part of the immune function, I think that's the awareness we're trying to create with parents, that, it's not this or that. Finally, sleep is at the top of everything. And if this is going to improve their sleep, their immune system response is going to be, much more stronger than just the function of the adenoids alone.
Correct. And there are a group of tissues called Walder's ring, tonsils, adenoids, lingual tonsils at the back of the tongue, and tubal tonsils. So there are other group of lymphoid tissue anyway to take care of the immune function. It's not that you have completely eliminated, and you reduce them to size. Nowadays, we hardly take out the tonsils completely. We reduce them to size with plasma. So that part of the tonsils is kept behind, say 10%, so that it can keep functioning.
Brilliant. Yeah. That's new for me as well. So speaking about the deviated septum, you see a lot of people who have this. Is surgery the only way through, or have you seen, any other changes that people can make when they have this deviated septum?
So if the divider on the highway is crooked, is there any way to correct it without physically correcting it? So if somebody has a bone which is bent, which is deviated, which is causing the blockage, in this life, it cannot be tackled by any other means. And it's a pretty simple surgery, can be done by any good ENT surgeon near to. So a deviated septum is a lifelong issue. What happens is that people feel that their nose is blocked, they have cold, they have sneezing, they have headaches, and they may have allergy. What is important is to differentiate between a structural problem versus an allergic problem versus a combined problem. As I say, 50% of the population has some kind of deviated septum. Every deviated septum does not require surgery. So whether the deviated septum is deviated enough to cause a problem, that is the first question. Whether allergy is also associated with deviated septum. So if there's no allergic problem, that means if your CT scan is normal, if your sinuses are clear, and your IgE levels, which are the measure for allergy, if that is normal, and the problem is only deviated septum, it's a structural problem, you treat it lifelong with medicines, it will never be effective. But you do a simple surgery, 25-30 minutes surgery, 2 days nasal packing, maybe another 4 or 5 days rest at home, and within a week you're good to go. It's a pretty straightforward surgery done in proper hands, has practically no complications. So, and again, with that, we often perform turbinoplasty. And if required, if the sinuses are involved, then we also do navigation-guided endoscopic sinus surgery. So with sinuses also now can be tackled with navigation-guided systems, minimally invasive. So it's a daycare thing. You go home in the evening, just rest for a couple of days with the pack in the nose, another 3-4 days at home. Within a week, you're good to go. And your sinus issue also can be tackled, taken care of for life.
Wow.
So what most important is the diagnosis. Now, say CT scans have become very small. They're there in the clinic itself. So patient walks in, we immediately do the CT scan. We understand what the issue is. So we do not waste our time in giving 6 months medicine, try this, try that, then some steroids, some this, some antibiotics. This is all, your body is not a lab. So it cannot be experimented on by try homeopathy, try Ayurvedic, try this, try that. It's not a hit and trial thing. You have to diagnose it properly, and then whatever is the problem, treat it aggressively. If it is a structural issue, surgery is the answer. If it is an allergic issue, anti-allergic is the answer.
I really like your approach, doctor. It's at a root cause level. Figure out a root cause and then take the required action. I really appreciate your way of working. So now we spoke about children. I've understood that. Now let's come to adults, where we believe there's a lot of undiagnosed population of sleep apnea, because practically 1 in 2 patients we see every day has every single symptom of it. And we also correlate it with their metabolic lab parameters of diabetes, high triglycerides, and everything else. We know that just losing weight is not going to solve the problem. So how can you educate our audience on, if you're an adult, we know snoring is one of them, gasping, choking, the breath stopping. So are there any other, points that you would like to, give adults, and also talk about the fact that if it goes undiagnosed, or we know it's possible sleep apnea, but we don't do anything about it, what are the repercussions of that?
Right. So the most important point I'd like to make here is that it's commonly believed that obesity is the cause of sleep apnea.
Mhm. What is it?
Obesity is also a result of
Yes.
sleep apnea and disturbed sleep. So if you do not sleep well, if you do not get into the REM sleep, if you do not get into the deeper sleep, the regeneration of your cells is not happening.
Right.
So life is anyway getting short.
Mhm.
And the hormones called leptin and ghrelin,
Mhm.
which are very widely studied, I'm not getting into the details of those hormones. They alter your hormonal balance, your metabolism. Your metabolism becomes slow. Your hunger becomes more. Your satiety becomes less, and you keep eating more and more. So
Mhm.
this is a vicious cycle. Obesity leads to sleep apnea leads to obesity, further obesity leads to further sleep apnea leads to further obesity,
Mhm.
till the point that you get trapped into this cycle, and then everything becomes very difficult. So we have to identify this problem at an early stage when the person has not really become obese and he started picking weight in the early 20s, 25, say 30s, 2030s. We have to identify those people then and there, because at that time, to identify the problem and cure it is much easier. So at the age of 60, 65 or 55, 60, when the heart already has got a stent as a result of all this issue, then you cannot stop the blood thinner. You cannot perform a surgery at that age. And if somebody's nose is blocked, you cannot put a CPAP. CPAP will not be effective because the nose is blocked. How it can work? The pressure required is very high.
Mhm.
So most important thing is to identify people early.
Mhm.
If they have this tendency of upper airway resistance and sleep apnea, they have to be diagnosed and treated at the earliest so that they do not progress into obesity and sleep apnea cycle and get trapped over there.
Mhm. So, doctor, a lot of these hospitals run executive packages. You go check your eyes, your teeth, your blood report, heart. They need to start putting this and that as well. The whole sleep study. I think
Yeah,
it's something that really needs to be
actually.
part of it, mandatory.
So I would suggest, see, doing a sleep study in a hospital has two problems.
Okay,
One is that the cost becomes high.
got it.
A
Yeah.
level one study in the lab, the cost is 18, 20,000, which is
Mm.
not feasible for a normal person. The second problem is that sleeping with those many wires into a hospital room itself is intimidating.
Yeah, yeah.
So if we can simplify it by doing home sleep study, which is
Mhm.
very common in even Western countries, the screening part can happen.
Mm.
Now, if somebody has got a severe sleep apnea and some other cardiac issues or diabetes and blood pressure kind of things, then his doctor can recommend for a level one, a full sleep study.
Mm.
Then it makes sense to, do a full sleep test, sleeping in a lab and all that. But I would suggest that if you can do a basic sleep study at home, at least the majority of the people can get it done at a very nominal cost, sitting in their own, sleeping in their own rooms. That makes life much easier.
No, I think I'm going to use this point as well to, through this Sleep Deeper India campaign to drive the awareness, because I didn't know you can order a kit on Amazon and do it.
Yes, you can
Amazing.
call it yourself and just put it on your finger.
Yeah,
3 nights you can do this study.
I'm going to do that. Yeah,
Yeah.
I'm going to do that for sure.
And there are various companies which will send boys at home, which will come with a proper sleep study. This is a level 4 study,
Okay.
which is itself is, I would say, good enough to screen, but a
Mhm.
proper sleep study also can be done at home.
Got it. Okay. So, so yeah, we know about the complications if it's left undiagnosed and patients just go on living from metabolic syndrome. I know there's research links showing even certain cancers and all of that, I guess, because it affects the body as a whole. What are some of the lifestyle changes you think India needs when it comes to, everything in the human body is interconnected? See, today there are
Yes.
allergies, there's pollution. As a doctor, and you see so many patients, as a surgeon, you're looking into so many bodies. What comes to your mind if you had to talk to India right now and give them a couple of lifestyle changes to make? What would they be, doctor?
So I think we have to cut down on the samosas and the vada pavs. First of all. The food, I think, is our food is more rich in calorie,
Yeah.
and we are not salad and uh, less calorie oriented society. So our food is a lot of ghee and stuff has to be controlled, fried stuff, and we have to be more pro towards salads and less calorie food. We have to stop eating more in the night. So it goes like you have a breakfast like a king and dinner like a beggar. So you have to eat less in the night, because you eat more in the night and you go off to sleep, it gets accumulated. That is the first change that our country can do as a whole. Vegetarian diet is a very, very important thing, because the non-vegetarian diet, it has got a lot of ill effects. And in fact, people are turning vegan across the globe. And vegan is difficult in our country to suggest, but vegetarian is certainly something that I strongly recommend people to try and see the good effects on their health. Having a schedule which permits them to sleep for 6 to 8 hours without disturbance is very important. If it is feasible, then sleep hygiene, as I said, do not look at your mobile phones. You can switch them off in the night, and screen time has to be reduced before sleep. These are the basic things people can do. And if somebody is not breathing well, whether it is a small child, whether it is a young adult or an older person, the nose has to be looked at, because that is something that any ENT surgeon nearby them can have a look and suggest some treatment. If somebody has got allergy, obviously they have to keep their air clean. The dust has to be taken care of, and other anti-allergic measures to be taken care of. But that's what I believe as lifestyle change we should be doing.
Right.
And exercise. Sorry, I missed that. Regular exercise is very, very important. Walk as much as you can.
Right.
So don't sit into the car. Nowadays, we see people not climbing the stairs of the gym. They are actually taking a lift to go to the gym.
Yeah.
Going to the gym and taking a lift.
That's quite fun. Yeah. Doctor, you're busy, you're in surgery, you see so many patients, you've led so many medical organizations, all of that. What are some of the lifestyle changes that work for you, and how do you maintain your health? How do you maintain your sleep, considering you have night calls, you have day surgeries? We would love for you to talk to us about you.
It's a very difficult topic. I think this is the most difficult part of the talk. Yes, we are... as a doctor, as a surgeon, my job is pretty intricate. I mean, and we do all sort of difficult surgeries, and I'm also into research, and I'm into training, and I'm into academics. So a lot of time goes into that, and then we have our clinical work as well. I believe the amount of work and the quality of work is one side, but if you train your mind not to take stress, we have to understand that we cannot change the destiny, neither my destiny nor the destiny of the person that I'm seeing. So I'm not a temple going person, but I believe very firmly in destiny, that you do your work and leave the rest to the superpower. Whatever name you give it to superpower, you call it to God, you call it Allah, you call it Shamasi or Krishna or Rama, whatever you want to call it. There is a superpower which is dictating the world, not me, not you. So you do your work honestly. You do as much as you can do. For me, the biggest puja is to treat a patient honestly.
Beautiful.
To tell him what honestly he has, and to do my best what I can do for the patient. And then do not take stress about what is going to be the result. Like Gita says, that believe in your work and not in the results. Results will automatically come. Whatever they have to come, they will come. So I'm 52 now. Almost 34 years of...
you don't look 52.
Yeah, I finished 52. So, and I'm a diabetic. That's my genes. Can't help it. But fine, you take care of your diet. And when you go off to bed, do not carry any tension.
Right.
Mumbai bhasha mein tension lene ka nahi, tension dene ka. So that is one thing that if I believe taking stress and thinking too much, overthinking and thinking that I can change everything and I will do everything, that is not really going to help. You should have pride in your work. Absolutely. You should do the best. But you cannot change the destiny of every person. You cannot, you can try to make change, but you cannot decide the change. The change is a superpower which will change it. You make your contribution and be happy about it. That's my way of reducing my stress.
I think that's beautiful, and it definitely looks like it's working on you, because what we see in most of our stressed out patients, they're trying to control people and things that cannot be controlled. Instead of focusing on what is in my control, let me just give my 500% to that.
Absolutely.
What is not in our control, there's nothing we can do about it. We have to surrender now.
Absolutely. See, as doctors, could we treat COVID? We could not. For 1.5 years, I mean, till the vaccine came, and so as clinicians, we had nothing, right? So it was the scientists who actually made vaccine and drove the corona away from it. So it's not that I can do everything for the patient. It's not possible.
Yeah.
I'm not a pharma. I cannot develop a new medicine. I have developed few new surgeries which I can do as a surgeon. My techniques, I do that, right? So I cannot do everything. So similarly, every person has to understand that even if somebody is a builder, he has to make a good and safe home. He cannot change the destiny of the person staying in that home, but at least he can do his work well. He gives it in time. He gives a nice and trouble-free home, and he has done a good society service to the society.
Right. So, doctor, I wanted to ask you, with this whole raging buzzword longevity. Today, longevity is everywhere. In the Western world, people are coming up with ways to live longer, supplements, procedures, all of that. I came across a lot of questions that people were posting to me. In the West, people have started using a CPAP machine, even without diagnosis. They're just using it to sleep better at night. Possibly they have a problem, but without diagnosis. And they're saying that is going to increase longevity. What I want to understand, of course, there are no studies yet, but what is the harm when people use a CPAP machine without the prescription of a doctor? What can happen? Yeah.
So in fact, there was a very long study. I do not remember the name of this study. It was a very big trial. They saw that people using CPAP for 5 to 10 years who were known case of sleep apnea, and they were using CPAP, the longevity was not actually even increased in them.
Okay.
So CPAP is the gold standard treatment for sleep apnea, but it was found that even in them, the longevity was not statistically significantly improved. So I really don't think putting a CPAP on you is a good idea. But if there's a blockage, if you're not sleeping, sleeping on the sides is a good habit. If you sleep on your, on your back, the tongue tends to fall down. So sleeping on the side is a good habit. Basic things can be practiced, but if there's a blockage in the air passage, now it's completely natural to correct it. So it's not an unnatural. People say, no, we do not want to disturb. If you have a deviated septum, it's pretty natural to have a normal septum. If there was a problem in your development and because of that your septum becomes crooked, get it corrected. It's a very natural thing. Putting a CPAP is, again, not a very natural thing. But if somebody is having sleep apnea, he has to get treatment. Whether it is surgical or medical is a different thing. I'm a surgeon, so I would advocate surgery if it can work in younger patients. In older patients, I never advocate surgery. Because CPAP is the best thing for them. It's a non-invasive thing. Correct. Younger people, for 50 years, if somebody asks to put a CPAP, is a difficult thing. But if some person is very comfortable, he can go with it. But without a diagnosis, CPAP is overdue.
Yeah, I thought
so. Yeah. I really don't think it will create any ill effect on the heart, apart from drying of the mouth and all.
Yeah.
But maybe aerophagia.
Do you think it'll actually weaken your upper respiratory because now you're getting it won't?
So it's basically, but see, like why people did not have sleep apnea in earlier days, because they were chewing harder now. So our muscles had become strong. Nowadays, we are using more of the processed food. So we do not have to chew so much. And therefore, our throat muscles are not that strong. And that's one more reason for sleep apnea. So if you use CPAP, so gradually what you're saying is that the muscles will not have to work. And then you'll be used to CPAP, and then you cannot sleep without CPAP, because the muscle tone need not work on you if you're using CPAP. So what you're saying is actually right. They will not become weak, but they will become lazy,
Lazy.
They will become lazy. So now you'll get used to CPAP. You cannot sleep without CPAP. I would sincerely not recommend anybody not having sleep apnea to use a CPAP.
Yeah, so I guess these
You
are
work on your breathing. You can do some myofunctional therapy, we call it medically, but you can simply do some exercises for the tongue, right? For the throat. Balloon for blowing balloons is a very, very good exercise. Your throat muscles become strong. The palate becomes strong. So I recommend to almost every of my patient to blow balloons.
Good one. Yeah.
That is something that everybody can try.
That is strengthen your throat, which is
especially your soft palate.
Correct.
Because see, when you're blowing balloon, what is happening?
Mm.
The air has to come out through the mouth. It should not come out through the nose. So your soft palate is the one who is doing it. So your soft palate becomes strong. And if your soft palate is, toned, it will not collapse in the night. So your tongue and the soft palate becomes more taut if you use ballooning exercise.
Oh, that's a brilliant tip, Doctor. Thank you for that.
Yeah.
Doctor, this has been amazing. I'm not going to take more time, but how do we reach you? How do people reach you if they want to get in touch with you, your team? Because now I'm sure everyone's going to be, like we have all these symptoms. We need to start getting checked and, diagnose more from a preventive aspect, because I believe in prevention. So what's the best way to reach you? Do you travel a lot?
People can Google me out. So my coordinates are there on the Google, but a very easy thing is to remember is I'm an ENT surgeon.
Right.
I have an ENT hospital. So doctor at the rate enthospital.com.
Got it. Okay.
Very easy. My email is very easy, doctor at the rate enthospital.com. So anybody can write to me with their phone number, so we can reach out to them and offer any help from any part of the country. My vision is the same. India should sleep better. India should sleep deeper and, be free of sleep apnea.
Thank you, Doctor. This has been a pleasure talking to you, and we really appreciate you taking time out of your busy schedule to help us create this awareness and educate us. It's been so informative, so informative. So thank you so much for your time. Yeah, thank you.
Thank you, Luke.
Hi, everyone. So I think that was a great conversation. There's always so much to learn, and I think the whole intention of our podcast is to keep an open mind. There's so much of information coming in from experts, scientists, doctors, nutritionists, healers. And what do we do with all of this information? We listen, and then we empower ourselves using our logic, asking the right questions. So the whole point is putting ourselves in the right path or with right thinking. So I think that was a beautiful podcast, and thank you for listening in. And remember, it's always about small wins every day. Whatever change we're trying to make, they're always small wins with consistency and self-discipline. And of course, if you haven't got our copy of Small Wins, the national bestseller, make sure you pick it up, because we cover all of these small points together in little easy wins that you and your family and everyone can make around the world, no matter where you are. So make sure you start to sleep really deep. I can't tell you how important it is. Every day, I would say 1 out of 2 patients, most of their problems can get better. Most of their diseases can get better when they start to sleep deeper. And that is the importance of sleeping deep. So make sure every podcast you listen to, if you spend 30 minutes listening to it, an hour listening to it, if you want to make that hour or 30 minutes worthwhile, what are the action points that you can take away and put into action?
Stay tuned for more. We're going to continue our journey, learning, sharing, and evolving.